In this module, we will review OSHA Standard 1910.1030, also known as the Bloodborne Pathogen Standard. This federal regulation establishes clear rules that protect healthcare workers from exposure to potentially infectious materials. The purpose of the standard is to reduce your risk of contact with blood, bodily fluids, and other materials that may transmit diseases such as hepatitis B, hepatitis C, HIV, and numerous other pathogens. OSHA created this standard because healthcare employees, like you, work in environments where exposure may occur unexpectedly. The standard requires that every employer develop an exposure control plan. As covered in Module 1, Nobleman Care Services maintains this plan and updates it annually or sooner if new procedures, equipment, or tasks create additional exposure risks. OSHA mandates several critical components for employee safety. Engineering controls such as sharps containers and safety needles. Work practice controls, including hand hygiene and proper disposal procedures. Personal protective equipment, PPE, which must be provided at no cost. Employee training at time of hire and annually. Access to hepatitis B vaccination at no charge. Immediate response and follow-up after an exposure incident. Strict documentation and record-keeping requirements. It is important to understand that this standard is not optional. Every employee in a healthcare setting is legally required to follow these safety procedures, and Nobleman Care Services is responsible for ensuring you have the knowledge and equipment needed to protect yourself. OSHA inspections may occur unannounced either at the patient's home, at our office, or during documentation audits. During an inspection, OSHA will verify that employees understand the exposure control plan, know where PPE is located, use it consistently, and follow sharp safety procedures. By following these guidelines, you not only protect yourself but also ensure compliance with federal regulations that safeguard patients, families, and your fellow employees. Before diving deeper into PPE, it is essential to understand what bloodborne pathogens are and why they pose a significant risk in home care settings. Bloodborne pathogens are infectious microorganisms present in human blood and certain bodily fluids. These pathogens can cause life-threatening diseases if they enter your body through a needle stick, broken skin, mucous membranes such as your eyes, nose, or mouth, or through direct contact with contaminated materials. In home care, even simple tasks, like assisting a patient with toileting, cleaning up a spill, or helping with a nosebleed, can unexpectedly expose you to these pathogens. This is why universal precautions and PPE are required every time there is even a possibility of exposure. Common procedures that may involve bloodborne pathogen risk include wound care and dressing changes, blood glucose monitoring, injection assistance, catheter care, handling soiled linens, cleaning spills of blood or bodily fluids, assisting with toileting or perineal care. Bloodborne pathogens are invisible. Patients may not be aware that they carry them, and caregivers must never rely on assumptions based on age, appearance, or diagnosis. Following OSHA guidelines fully and consistently is the safest and most effective way to protect yourself. Personal protective equipment, or PPE, is one of your strongest defenses against exposure. PPE acts as a barrier between you and potentially infectious materials. Nobleman Care Services provides all required PPE at no cost to you. This includes disposable gloves, masks, and N95 respirators when required, eye protection such as goggles or face shields, gowns or impermeable aprons, shoe covers when appropriate, CPR face shields with one-way valves. Each type of PPE serves a specific purpose. Gloves protect your hands from direct contact with blood and bodily fluids. Eye protection shields you from splashes or droplets that may carry infectious materials. Masks and respirators protect your airway. Gowns and aprons protect your clothing and skin. PPE must be readily accessible during client care. If you arrive at a home and discover that PPE is needed for a procedure, you must retrieve the proper equipment before continuing. Care should never begin without the appropriate protective gear. One of the most important responsibilities you have is to inspect PPE before use. Gloves that tear easily, masks with broken straps, or goggles that are cracked should be replaced immediately. Never attempt to repair damaged PPE. Remember, PPE is effective only when used correctly. This means putting it on before contact with blood or bodily fluids, and removing it carefully to avoid contamination. You should avoid touching your face, your phone, or personal belongings while wearing gloves. Gloves must be removed and hands washed before touching clean surfaces, documentation, or other equipment. Correct use of PPE involves 3 major steps: putting it on, removing it, and disposing of it properly. Mishandling PPE increases the risk of contamination, so these procedures must be followed carefully. Putting on PPE, donning. Begin by washing your hands thoroughly with soap and water, or using an approved hand sanitizer. Put on the gown first, if required. Tie it securely so that it covers your clothing and skin. Next, put on your mask or respirator. Ensure a snug fit around your nose and mouth. Place goggles or a face shield on last to protect your eyes. Finally, put on gloves. They should extend over the wrists of your gown if you are wearing one. Removing PPE, doffing. Removing PPE is often the most hazardous part of the process because the outer surfaces may be contaminated. Gloves must be removed first. Pinch the outside of one glove at the wrist, peel it off, and hold it in your gloved hand. Slide your ungloved finger under the wrist of the remaining glove to peel it off without touching the outside surface. If wearing a gown, untie it and pull it away from your body, touching the inside only. Remove eye protection by lifting the strap or earpieces from behind your head. Remove your mask last, using the straps, not the front. Immediately wash your hands or use sanitizer. Disposal. All disposable PPE must be placed in designated waste containers. PPE used during exposure-prone procedures should be placed in a biohazard bag. PPE must never be thrown into household trash unless approved by agency policy. These steps ensure that contamination stays contained, protecting both employees and patients. Sharp safety is one of the most critical components of reducing exposure. Sharps include needles, lancets, and any device capable of penetrating the skin. Injuries involving sharps are extremely dangerous and can transmit serious infections. To prevent needle stick injuries, OSHA requires specific engineering controls designed for safety. Nobleman Care Services provides puncture-resistant sharps disposal containers, safety-engineered needles, and one-time use lancets. These devices are designed to limit your exposure risk when used correctly. Sharps safety rules include: never recap needles under any circumstances. Never bend, break, or remove needles by hand. Dispose of sharps immediately after use. Never carry them from room to room. Place used sharps directly into an approved sharps container. Do not overfill sharps containers, replace them when they are 3/4 full. Report defective sharps devices immediately. Sharps containers must always remain upright, closed when not in use, and located in areas where they can be easily accessed during patient care. If a container is missing or full, you must contact the administrator for replacement before performing any procedures involving sharps. In the event of a needle stick or sharps injury, follow these steps immediately. Wash the area thoroughly with soap and water. Notify your supervisor and seek medical evaluation. Complete an incident report. Follow post-exposure protocols as instructed.